Hi, everyone. Good evening. Well, my name is Adriana. I'm a physician. I specialize in internal medicine and pulmonology. And now, today, I'm going to talk about what possible health incidents can help happen during an on-site missions. Next, please, Julio. First of all, we'd like to say that the Mission Control Health team will be available 24 hours a day during the entire week to connect to the participants in the missions via messages, video, or telephone calls. We can provide during telemedicine, medical care advices, is health information or instructions due any kind of issue or health problems that can happen during the mission. Next to Habitat Marte, there are three places that we can refer that even any kind of health issues. In Caiçara Rio do Vento is the nearest place where we have a facility, a health facility. In Lages, which is next from Pico do Cabugi, as a hospital. In Natal, that is a capital from Rio Grande do Norte, is far, but is the biggest place on more infrastructures in terms of health care. Next, please. Well, the health safety form is the formulary that all participants should complete before starting the mission, because we had vital information about any previous health problems that can be we have to give attention, and for us the health team is important to prepare the infrastructure to deal with any kind of situations that can be happen there during the missions, especially in the extravehicular activities, which is have to be have a high performance or even a moderate performance, because it's a very strong physical activity. It will not need to say that all health information is confidential, is not going to be shared with any other participants. And next, please, Julia. The healthcare protocols we're working on is including any to manage health problems or issues, incidents that can be happen in the airspace complex. Will include Habitat Marte, Habitat Lunar, Lava Cave, and Pico do Cabugi. The medical procedures, all of them should be guided by a medical or in person if there is this needed, or by telemedicine, as I said before. And also has the intent to enhance the safety of the participant, and it can be used as a tool for any procedures that can be done. Next, Julio, please. Um, but all medical actions there are some situations that like urgent or emergency situations that can be evaluated by in-person medical professionals. So especially specific, and when we are uncertainty about the proper actions that can be done, or in case of severe or emergency situations. In this case, the participants should be um, must gone to the health facilities, as I mentioned before. Next, Julio, please. The first health issue I'm going to talk is about pain, and one of the most common situation is the kidney stones. Kidney stones is a specific disease that gives a very strong pain in the back, and is caused by stones formed in the urinary tract. and the pain is located in the back. Maybe sometimes it can refer in the genital area. It's not improved with the change of position and can also be monitored. You can monitor the urinary volume because sometimes it is a block to the urinary outcome. Sometimes the patient has also pale skin, sweating, vomiting, and the fluid intake can be managed because if they have nausea or vomiting, it's better not to insist in giving fluid intake. If you have fever, we have suspicions of infection or urinary together, so it can be a situation that we have to go further in the investigation of the health facility. Severe pain as well that not answer to the use of regular medication can be referred to health for injectable proper medication. Next, please. Abdominal pain is a concern of every physician because it can have so many things that can happen. There are a few tips that we have to see about location, intensity, duration, the type of the pain, and if you have irradiation, if you have fever together, or the time that arises, the several hours is it's one of the option, but it can be acute as well. The periodicity. So all information that we can get from the abdominal pain help us to deal with the possibilities of this diagnosis and proper conduct. Next, please, Julio. The most common abdominal pain are related to some very common situations like indigestion, in medicine we call dyspepsia. There's a discomfort in the belly. Gastritis can also be present, but at the formulary you asked about previous situations. So sometimes you will be aware that the participant has some gastrointestinal disease, so you'll be prepared to receive them for specific medication. Gastroenteritis can be caused by an infection or intoxication, and is related to diarrhea and vomiting. Is also can have abdominal pain. The vital signs always have to be checked in these situations: the blood pressure, the oximetry, and the fever, the temperature, because this change everything the conduct they're going to do with the participant, the patient. Next, please, Julio. But there are a few situations that is very concerning about the need of a surgeon or a specific health facility, which means that some kind of pains that we are thinking about appendicitis or gallstones inflammation that cause inflammation that also cause a very strong pain, and this kind of situation should be evaluated in a proper place because they need further exams and blood tests, and sometimes for appendicitis it do need surgery, and the pain starts around the belly and moves to the lower right abdomen, can be together with nausea, vomit, and fever. And it's a surgical procedure that must be done quickly. So if this starts with this kind of clinical presentation, the patient should be delivered to a specific place. Gallstones also has a very strong pain, but in the upper abdomen, and can be together with nausea and vomiting. And sometimes the only oral medication doesn't help, so you have to go to the hospital to get IV medication specific. The vital signs has to be checked as well. Next, please, Julio. Dehydration. We are talking about a place that Marte is in the northeast of Brazil. It's very hot during the entire year. So, dehydration is a concern and about clinical problems. And is defined as when you lost liquid more than you didn't take. So, the symptoms are dry mouth or intense thirst, low urine, and sometimes the heart rate is increased and the blood pressure can get low. So, is in serious cases, in severe presentations, there can be altered consciousness as well. Um, in the beginning, in the start of the hydration, we can manage with oral hydration. But sometimes when it's severe emergency, we have to go to the hospitals to go to IV or of IV fluids to repair the hydration of the body. Next, please, Julio. Gastrointestinal symptoms like diarrhea is a common, especially we are talking about a different place, different food, so can be found in a mission. Can be self-limited, but sometimes it lasts more than 12 hours or a day. The concern is the number and intensity of the episodes because it can is one of the most common cause of dehydration. So another problem that we have is if you see blood in stools and vein of together with vomiting and abdomen pain. So in this situation, they have to be referred to the unit health unit. We can also manage the vital signs. Start maybe with oral hydration and like isotonic drinks or oral solution, but the IV medication will be needed if it doesn't get better. Next, Julio, please. Vomiting is also um, a situation that can happen and can be due to caused by many things, and we'll try sometimes to figure out what was the cause. Sometimes we don't know, but in the most cases there's a suspicious food or water, and can be also together, combined together with other kinds of situations, not in gastrointestinal symptoms like migraine, cramps, or insolation. So vomiting is a concern because together can be dehydration. So if the patient is vomiting, nothing is not indicated to try oral hydration. But medication can be prescribed IV intravenously in the hospital if there's no improvement with um, oral medication. Next, please, Julio. Headache is also another situation that can happen. The problem about headache is if the acute headache, you have never had one like that before, is a concern about situations like stroke or something else. But sometimes it's related to our situation. We are talking about the analog mission could be related to heat exposure, stress, physical or mental, or a flu and infection that can be together. The blood pressure is a sign that can be evaluated cause a high blood pressure could cause acute headache in people that are not used to have this kind of symptom. But when you have a chronic headache like a migraine and you know what the characteristics of the episode, it's a little bit easier to deal because you know that it's going to be triggered for some kind of specific things like light, heat, or stress, and can be also be you have the participant can also be prescription, private prescription, and the steps to use when it starts the migraine crisis. But sometimes it needs also injectable medication. Next, please, Julia. Back pain. We talk about back pain because we are going to do sometimes doing the Pico do Cabugi is a strong intensity physical activity and also can occur. Um, it has the same way we have to ask about previous symptoms in the back pain, or maybe if you could do it to a kind of EVA activity. All the characteristics should be evaluated as well. And you can use painkillers or anti-inflammatories with a guide of the health team. Local heat is good. Gabriel, we talked to Gabriel about what the other procedures that we can use. Um, so you can stretch. Stretching can be good for some back pain, but of course, if you're not increasing, not getting better, the participant should take the hospital to see what's going on. Next, please, Julia. Well, let's talk about a little bit about flu and colds, which is also a concern because we are going to be confined in a closed environment. So every symptoms that start with headache, nasal congestion, sore throat, fever, the first step is to start using masks. And the blood saturation, oxygen blood saturation can be also checked, the temperature. And if not, the symptoms not getting not getting better with symptomatic medication like painkillers, it's necessary to go to the hospital to do the COVID-19 test, which is still with us. So we have this concern also. Next, please, Julia. Fever can be a sign that can be related to so many problems, health problems. So it's just a sign that we have something to research and to go further. So the most important aspect is that don't get a temperature after doing an EVA activity. It's better to stay in the place for a while, then not cold play, not to not hot place. Sorry. Then after a few minutes, you get the temperature. Could be infection, could be inflammation, could be a lot of things. But as another other symptoms, if not getting better, we have to do exams. So the next to facilities is imperative. Next, please. Cough. Coughing is a natural defense of the body, but is related with so many diseases, not only infection disease, but exposure to smoking, to smoke, and air pollution and other disease. But in case of starting a cough symptom, it's important to firstly get check the vital signs, especially the blood oxygen saturation. But sometimes it's need to get an exam, entire lung exam, because could be pneumonia or something or asthma attack. So it's important that in this case the participant can be referred to the station as well. Next, please, Julie. Shortness of breath is related with disease, and also it's the definition is a subjective feeling of you have difficulty breathing. It's related to cardiac problems, to lung problems, to dehydration, so many other situations. But it's when it's related to a sudden episode, it's important to evaluate. There are few diseases that can health problems that can start with shortness of breath, like pneumothorax or a startup pneumonia infection, or even heart conditions like arrhythmia. So it's very subjective. We cannot measure how a person is having difficult to breathe. We have parameters, health parameters, and oxygen blood saturation is the most important. And of course, if you have together with cough, fever, and pain, so we have to go further with the investigation. Next, please, Julio. Asthma crisis is a main concern also because we are going to, asthma is inflammation, chronic condition we have in the lungs, so the bronchial can do narrowed when some kind of triggers, and there are so many triggers, and one of the most specific for us, that is the dust. And this exercise, we are going to be um, activity, that especially at Pico do Cabugi, and can trigger asthma, a crisis of asthma. At the formulary health, we ask about a previous situation, especially if you use what kind of medication you use regularly. We have at the Habitat Marte, we have bronchodilators to use, but if it's important to do the characteristics of your asthma, moderate, if it's what kind of trigger is most common with you to start the crisis, and then sometimes we have to go to the ER to get medication, IV medication, and oxygen as well. Next, Julio. Um, Chest pain is, of course, is a very important symptom and could be related to so many things. The inflammation of the pleura and lung, to the infection, to chest injuries, rib fractures, and musculoskeletal conditions. These are going to get as I said, strong activity. But the most important is to start reaching if it's a heart attack, which is going to be explained later for Dr. Janetti. This in the kind of situation is a situation that the patient could be delivered to the health facility straight. Is necessary a further evaluation. Next, Julia. Neurological disorders, labyrinthitis, it can be related to heat as a symptom that can be associated with spinning sensation, nausea, vomiting, loss of balance, and can be triggered by the heat and exercise. Once more, we are going to ask something about the formulary if you had or have had before an episode like this, and it's important to be prepared to deal with this medication orally, or if not, in getting better in a IV medication. Next, please, Julia. Hypoglycemia is a situation that is usual when you have specific related to diabetes, when you use insulin and not get proper food. But sometimes when you are going to be a strong activity, physical activity can, and related to the heating and the heat exposure and dehydration, it can appear. The symptoms, trembling, sweating, confusion is is common, but it's necessary to do the blood test, the glucose blood test, the glucosimeter, and maybe for a great activity, you can bring food and water or a juice to, just in case you have symptoms, you start, it can be quickly recovered. But sometimes if you don't get better, again, go to the health facility. Next, please, Julia. On the other side, hyperglycemia is related to diabetes. Yeah, those symptoms that start with increased thirty and urine volume. Fatigue as well as can be present. Um, Sometimes when you have high levels of glucose, it's necessary to get to the hospital to get insulin, IV or subcutaneous, depending on the situation. But sometimes we're not able to deal with the situation in the Habitat Mart. So if you have history of diabetes, that it can be presented that can be told to us before the mission. Next, please, Julia. Dermatological problems and allergies can also happen because we are talking about a place, as I said before, is hot during the entire year. So sometimes it's due to an allergy, sometimes it's due to a contact reactions to many things. And we have to try to evaluate what caused the allergy or the problem. And sometimes we have a medication that can be used topically, but sometimes we have to use antihistaminic pills to decrease the itching, which is a symptom. And but we have also chronic conditions that can be worse with heat and that will also stress and confination environment like psoriasis, urticaria, dermatitis, and mycosis. So this the characteristic of the lesion help us to think about what could be the lesion and the proper treatment for those situations. Please, next, Julio. Well, I think I'm going to talk a little about psychological and behavior situations because the confinement depends most of the time with the length of the mission. But anxiety and panic crisis can appear during the mission, and also the previous history can be evaluated. Sometimes the confinement environment, the different um, things that you are facing during a mission can trigger an anxiety or panic crisis. So we should talk about, remember that you have changes in sleep, food, and restlessness, and sometimes this can the sufficient to start an anxiety crisis. We have medication, but not in the habitat Marte. If this decreases the symptoms is very hard, we have to go to the hospital to get specific medication, and we also can use relaxation techniques and other tools. But I think that Professor Julio could talk a little better about this. Next, please, Julio. Depression is also related to long-term missions, but I was thinking about if you have a previous history of depression, if you are controlling the symptoms while using medication, you can do a mission. You're not forbidden to do a mission, analog mission, but the symptoms can be evaluated very closely because maybe if you have any sign of worsening the symptoms, it's like quite an emergency, in psychiatric emergency. So you have to do further steps to protect the participants. I think it's not usual, but we have to talk about this because it's a concern for analog missions. Next, please, Julie. As I said, psychiatric emergency, not only suicide, ideation, but if you have a previous drug abuse or any kind of behavior that can be worsened by this environment, all this kind of the symptoms can be we have to try to talk about them before starting the mission, but if get worse during, this is a situation that we have to protect the participant and go straight to the emergency to ER to get the specific medication. Next, Julio. Management the confinement situations. I would like to say about what this kind of scenario, that confinement situation, can influence the health. And we talked about the stress relating disease. So a confinement situation can relate to changes of behavior, and also, of course, the dialogue and trying to solve the conflicts that can be, but can influence in many health aspects. If you have had any kind of problems dealing with people before, is also a concern. But we talk about anxiety and stress during the confinement, which can cause conflict during the participants. So trying to talk about the problem and how those problems can impact in the team as a whole is important. Maybe I think it's important to psychological support. Next, please, Julio. And we are talking about a situation that emotional is very changing, doing many things, and tension, anger, discomfort can arise, and all of these aspects can be talked with the Professor Julio and the team as well. Everybody should talk about the behavior and emotional problems, and I think that is a concern more for long-term missions, but it's an important aspect that we have to talk. I think it's the last one. No. How can we imagine this? Well, there are so many techniques that we can use to manage the confinement situations and conflicts, and relaxing techniques and strategies. Resolution is a psychological technique that can be used. Listening and music, everything that can be used to increase the well-being of the participant it's welcome. So maybe can in all of this can impact, for example, in high blood pressure, in a triggering of an asthma, and triggering of a digestion condition. So that's the reason why I talk a little bit about this topics. Next, Julia. Well, that's it. Of course, that we don't have much time to talk about all the possibilities of health issues that we can face during a mission, analog mission. But me, Dr. Celso, and Dr. Jeanette, we are from the health team. We are available to talk about everything, and that's it. Thank you very much.